So we're gonna go over all the tests we do here in the BNG room, starting with tympanometry. Leslie, our veteran, today will demonstrate our test. So before we stick anything into anyone's ear, we're always gonna look inside to make sure it's nice and clean and there's not a huge wax buildup. If there's a huge wax buildup, then you won't be able to perform these tests. Leslie, did you clean your ears today?
Yeah.
Good. I did. So, when we look into someone's ear, you want to turn on the light. You don't want to jam it in too deep. So I'm going to rest my fingers on her head, and I'm going to look into her ear. I'm going to pull it, and I'm going to look for this little light. I'm going to look for the light at the end of the hole. Next ear. Same thing. Put my fingers on her head. Beautiful. No wax buildup. Good job, Leslie. So before we stick anything in anyone's ear, we're always going to look inside. This test is called the tympanometry. It will show us the veteran's ear canal volume. So we're looking for something like this, a little peek inside a box. That means we're going to have a normal ear canal volume. So I'm going to find a nice size for Leslie. I'll go blue. Blue is size 9 to 13 millimeters. And I'm going to stick this in Leslie's ear. She's going to hear a slight vibration sound, and we're going to have a peak. So with the tympanometry, you have to get a good seal in, or it's going to tell you leak. If you have a leak, you could try a different size. Or, fun fact, you could have the veteran do it themselves. Here, stick that in your left ear, please. There we go. That is a healthy response. Good job, Leslie. So that is the tympanometry. If your veteran does not have a healthy response and has an abnormal response, you are not going to do VEMS on that ear.
This is the hearing booth.
This is the hearing booth. So we're going to start with putting these headphones into Leslie's ears. Red is right, always. Blue is left. Oh, wait. So I'm going to clip these onto Leslie's shirt. Before I put the headphones in, I'm going to give Leslie this little button. So I'm going to tell Leslie that every time she hears a sound, she's going to press that button for me. All right, to put the headphones in, I squeeze the little tips. And I'll put it in her ear for her. I'll squeeze the tip. Put it in her ear. We're going to slightly expand, so I'm going to do a little tug to make sure they're in there. Beautiful. All right, back. All right, so maybe we zoom in here.
Leslie's in the sound booth.
All right, so I'm going to put on my little headphones. This is how I'll communicate with the veteran so she can hear me. I'm going to turn on the Auto Suite program. I'm going to put in veterans information when it pops up. Leslie. I'm going to keep my initials there. I need my paper because I don't remember their names. So before anything, you're going to press the talk back button so you could speak with a veteran. I'm going to press this talk forward button here. Leslie, can you hear me? And now I could hear her. So the first test we're doing is we're going to find out where her threshold is on her right ear. So I'm going to press the right button. She has inserts in, so I'm going to press the insert button. And we want a tone as a stimulus. All right. So what I'm going to do is start at 20. So in order to find someone's threshold, you want to play the sound. So I'm playing the 20 dB and it lights up green, meaning that she heard that. So I'm going to go 2 down if she heard it. I'll play this. She heard it again. I'm going to go 2 down and nothing. So I'm going to go 1 up. And she heard that, so I'll go 2 down again. Go up 1. I'll go up 1 more. She still didn't hear that. I'm going to go up 1 more. She heard that. We'll go down 2. So it's basically best 2 out of 3. She hear that? Is she gonna hear this? She heard that? I'm gonna press store, and that's her threshold for her right ear. You're gonna change the frequencies. You're gonna do 500 hertz, 250. You're gonna repeat 1000, do 1500, 2K, 3000, 4000, 6000, 8000. Once we do the right ear, we're gonna switch to the left ear. So I just press left. Again, it's insert, because we have inserts in the ear. It's a tone. We're gonna do the same thing. We'll start with the frequency. I'm going to press the, give her the sound, and then go down. Doesn't hear it, go up. Doesn't hear it, go up. And then one more time, go down. Good, store that. So you see the blue is left, the red is right. And that's how you find the threshold for your tone threshold. Okay, so that's one of the tests we do here. Next, we're gonna put a bone oscillator on Leslie and do the same thing. We're gonna play tones, but through the bone behind her ear. So I'm gonna take these inserts out. I'm gonna put this bone oscillator on. All right, so this bone oscillator needs to go on the bone behind the veteran's ear, right here. We're gonna go on the right side. And you only have to do the bone oscillator on one side. So I'm gonna do the left. I'm doing the left side, not the right. I'm doing the left side. All right, so same thing, Leslie, press the button every time we hear a sound. Bye-bye. So for the setup for the bone is a little different. We have the bone on her left ear, so that's fine, it's left. We're gonna press bone. Bone. We still wanna play a tone though, okay? So it's bone, tone, left. So I'll start here. Your bone threshold should be better than your air threshold. So where you're gonna expect the bone to be lower than the threshold, than the air threshold. We expect the bone threshold to be better than the air threshold. And you saw that she got that 2 out of 3. And that was her threshold. Good job. I'm not doing the white noise. If you have something like this, for instance, where it starts blinking, that means you're gonna have to do something called the white noise effect. You're gonna put white noise in one ear, you're gonna have a tone playing in the other ear, and you're gonna repeat the same bone threshold. Second, where we'll do 2 more tests. The first test, you're gonna have a computer automated voice at a comfortable hearing sound giving you words to say. It's gonna say the word dog, say the word please. Leslie's job is just to repeat that word, dog, please. The test after that, I'm gonna give her 5 words. They're gonna get softer and softer each time. She's gonna tell me what word she hears. You understand?
Yep.
Good. She doesn't need the button. All right, so the first one's going to be the word recognition. We're gonna press, we're gonna choose a list of words, so you can choose list 1A, 2A, or 3A, whatever you want. Make sure that it's on insert, because we have the inserts back in. And this time we want source A, because we want the computer talking. All right, so we're gonna start with the left ear, source A, insert, WRS word recognition series, okay? So you're gonna give her 20 words to hear, you're gonna press play. And you want a comfortable hearing sound. Okay, you want a comfortable hearing sound. All right, so I'm pressing correct every time she gets it correct. You could also press on the computer screen if you want. So I could just press green, means red. If she got that wrong, I would just press it again. It's wrong. All right, so you're gonna do 20 words. You're gonna write down her percentage. When she's done, you'll press stop and you'll press store. See? It's stored what dB you gave her and what percentage she got. Then we'll switch to the right side as well. So left, right, 20 words. Next test, is the SDT, speech detection threshold. So I'm going to press SDT. Inserts again. And this time we're going to press mic because I will be talking and I'll be giving her the words. All right? So I'm going to tell her the words. Make sure the veteran doesn't see your mouth, so cover your mouth with a piece of paper or something so they can't read your lips. All right, Leslie, I'm going to give you 5 words. They're going to be airplane, baseball, eyebrow, doormat, or stairway. Okay? Airplane, airplane, airplane. Why doesn't she hear me? Stairway, eyebrow. So it's the same thing here. Every time she gets it right, you're gonna go down 10. If she gets it wrong, you're gonna go up 5. And then when you're done, you'll press store. We're gonna take off the inserts and we're gonna do the auto acoustic emissions. So basically this little machine is just gonna go in and play sounds in her ears, little clicks and ticks, and it's giving a measurement of her entire ear canal for us. So you're gonna put so it's this little device here. We're gonna put one of those tips on that we'll use actually for our tympanometry. We're gonna do it in her left ear and her right ear, okay? I'll show you on the computer what buttons you press. So for our auto acoustic emission, we're gonna press view, auto acoustic emission, dp gram. You wanna make sure you save your data. And then we're gonna press, we'll use the purple one for the left ear and the orange one for the right ear. And it'll do its calculation. Please look at the SOP that I wrote up. It'll show you the final results of what it should look like. Turn on light in that room. Ready? So now we're going to do the video head impulse test, Ihpl. So this measures our semicircular canal. We're going to put on this nice little face mask so every veteran has their own nice and clean hygiene. As you may notice in our room, we have all the lights on because it's very important that all the lights on are during Ihpl. Your keep this on. So we even have this handy dandy little light. The program is Auto Suite 5 or V. We're going to open that. Helpful tip, make sure your goggles are plugged in before turning on the program. I'll tighten these goggles on my veteran. I want them really tight because I do not want them sliding. Also, another helpful tip is to raise her right eyebrow and kind of just move the goggles so her eyes are nice and open. It's really important that your veteran keeps their eyes open. All right, beautiful eyeballs. That's Leslie's eyeball. First thing is we want to choose the region of index. So we want to look straight ahead, Leslie. Okay. So we're going to choose that. That's her pupil. Press OK. And then we want to calibrate. So I'm going to turn on these lasers. And see, Leslie's sitting comfortable. This is where she's looking. I'm going to take this cute little blue sticker and put it right between those red dots. So that's where she's going to be fixing when we're doing the Ihpl test. Right now we're going to calibrate. One of those red lasers is going to start jumping left and right. You're going to ask your veteran to look at that laser as it's jumping left and right. So I'm going to press run and you see it's jumping. And Leslie's looking back and forth nicely on the screen. You can see her eyes jumping. Very nice. It's a clear, not too spiky, not too crazy. Looks really good. Those spikes like that are Leslie blinking. Okay? Don't tape your veteran's eyes. All right, I'm going to press accept. There's 3 tests with the Ihpl. We're going to do lateral, like this. So it's measuring our lateral canals. We're going to move her head to the right, and we're going to do LARP. So here we're going to move her head up and down. And we're going to do RALP, right anterior, left posterior. So LARP, left anterior, right posterior canals, and RALP, right anterior, left posterior canals. All right, so Ihpl is just a talent. I'm going to show you lateral, and you can see the screen to see how it accepts it. With Ihpl, you want to do really short and quick movements. So I'm going to hold her head really tight and kind of just jerk her head. There we go. right, so we see how they're accepting. So here you see that the velocities are nice and quick. So the green is her eye tracing, the yellow is her head movement, okay? So those look like clear V hits. So we're gonna do 20 each. For demonstration purposes, we'll stop here and I'll show you RALP. So impulse test, I'll show you LARP. So for LARP, you wanna first make sure the veteran's head is centered. Okay, veteran, are you centered?
Yeah.
Press center. Now I'm gonna move her head to the right. Once it's in the green like that, it's perfect. I'm gonna ask if that's straining the veteran's eyes. Is that straining, Leslie?
No, it's good.
Okay. I'm gonna change the region of index so I can see her pupil. And if you get this like a lot of white specks here, you can adjust your threshold so you could get rid of those. So it's just tracking the pupil. Press OK. Or I like to keep my hands like this, again nice and tight, and I go up and down. Don't record the computer screen. Up and down. The computer screen will tell you if you're overshooting too much, if you're not going fast enough. So follow those comments so you could adjust your V-hit method. The VNG test, hence why this room is called VNG. It stands for video anostomography. First things first, turn on your projector. Then with these goggles, we have a little foam. So each veteran gets their own foam. I'm going to ask the veteran to hold this over their eyes, and I'm going to strap it so it's nice and tight. Again, tight, but you don't want it to give your veteran a headache. All right. So for the VNG, as you see, our chair is all the way up as high as it could go in the 90-degree position. Your veteran's sitting comfortably, looking straight at the screen. Okay? If you come over here, I will show you those program views. Alright, so we're going to use the auto access. So for demonstration purposes, we're keeping the lights on, but for VNGs, you turn off the lights. Alright, new client, Leslie, la. And then we like to keep, what year are you born? 1993?
94.
94, damn. Oh, I hate this. So we're gonna press VNG. That's the test we'll do today with Leslie. Excuse me. Oh, did I not press save? Save client information, VNG. So first thing is we want to adjust her eyes. So I'm going to press here. We're going to drag this to our screen up here. Beautiful eyeballs. This camera box is very similar to the SMI camera where it has 3 knobs. One goes up and down, one left and right, and one adjusts the focus. So I want to keep her eyes centered. Center X and B. And I want to adjust the focus. Beautiful. Up and down, left and right, adjust the focus. Beautiful. So now, I'll close this, and we can start with our first test. First thing is we're going to calibrate. In order to calibrate, you want to, in order to get to the calibration screen, right here you see it doesn't let you click it, just open any test. So any of these tests. Then we'll open the calibration, perform calibration. Again, this room would be pitch black. You're gonna ask your veteran to stare at that light as it moves left, right, up, and down. We'll press start, and she's gonna look at all those lights, okay? And it's gonna continue by itself, it'll stop by itself, okay? Okay. So our first test is the gaze test. Here your veteran is gonna see a smiley face on the screen. You're going to have one in the center, one that's going to jump to the left, one that will jump to the right, one that will go up, and one that will go down, as you see here. You're going to ask your veteran to fixate at that smile, press start. All right, so this test is just going to go for about, I don't know how long it goes, so I'm not going to say that. All right, so this test will go. Keep reminding your veteran to look at that light. If for whatever reason it's not tracking the pupil, you could adjust here so the pupil is nice and white and it'll track it. Okay, remind your veteran to stay awake, keep their eyes open. All right, then I'll do left, right, up, and down. Next test, smooth pursuit. Smooth pursuit, you're gonna have a smiley face again. And it's gonna start moving across the screen really slowly. Remind your veteran to look at that smiley face as it moves. Up. Next one is the saccade test. Here, the dot will jump around the screen. Again, ask your veteran to look at the screen, that dot as it jumps around. You see here, the green is the dot, her red is right, the blue is left. Those are her eyes. Okay. Next test, optokinetics. Here, there's going to be yellow and blue lines going across the screen. You're going to ask your veteran to focus in the middle of those lines and to count every yellow line that goes across. Ask them to count them to themselves. The goal of that is to have the veteran look straight in the center. All right, and we see this saccades happening, which is normal and good. With this test, the lines will go to the left first, then to the right, then they'll go a little faster to the left, to the right, and then 50 degrees a second is really fast. So remind your veteran if they feel dizzy or get a little nauseous that they could just close their eyes and we'll stop the test. No problem. Looking at their eye movement and, next is spontaneous nystagmus. Here we're just gonna put the faceplate on the veteran. And we're going to look at their eye movement just in the complete darkness. All right. So your veteran doesn't see anything. So in order to help them, you're going to turn on this fixation light that they could fixate for a little bit. Then you'll turn it right off. So I'm going to press start. I'm going to turn that fixation light is on, as you see here, green. I'm going to turn off that fixation light. And now you're going to ask your veteran to look where that fixation light was. So green here means the fixation light was on. All right. Next is the positional test. For the positional test, you'll keep the faceplate on. Ask your veteran to sit up. We're going to put the bench all the way down. Okay, go ahead and lay back down. So the VNG is helpful when you have someone else to operate the computer for you. But if you're ever alone, you have this little foot pedal here. You can start and stop a test right here by yourself. You could also turn on the fixation light. So as you see, I started that. I'm going to press start, and now it's collecting data. I can turn on the fixation light with this. I can turn it off with that foot pedal. Okay? So I'm going to show you the positional test. So you have supine, which is laying just like this. You have head right, where we're going to hold your veteran's head like this. You don't want the goggles laying down. We have head left, and then we have side. Does it say side? We have side right, side left. Here, our veteran's going to lean on their right shoulder. Go ahead and go on your right shoulder, and you're going to hold their head up just like this. Okay, you're going to make sure they relax their head into your hands. You're going to hold it just like this, and you'll do the repeat on the left side. So with this positional test, always turn on the fixation light for about 2-3 seconds, just so the veteran has somewhere to look at. Then turn off the fixation light, and they'll try to keep looking in that direction. Last test is our Dix-Hall-Pike. This test tests for BPPV. If you want to know what that stands for, look at my SOP that I wrote. Go ahead and sit up, Leslie. So with this test, if your veteran has BPPV, they are going to feel extremely dizzy during this test. Have your veteran lean forward. Come on, Leslie, lean forward to the back of the, scoot. Have your veteran scoot back. Scoot back a little bit more. And now we're gonna have her lean all the way back. Good, and I want her head to be completely off the bench just like that. Good job, get back up. So now we'll actually do the test. You're gonna do this on the right side, then you'll repeat on the left, and then you could do it again on the right, on the left. What I'm going to do is I'm going to hold the veteran's head to the side like this. And I'm going to give a countdown. I'm going to bring that veteran all the way back, have her head hang off the bench just like that for about 15 to 20 seconds. And then I'm going to bring her back up. If she has BPPV, she's going to feel extremely dizzy going down and when her head's back up like that. Ready, Leslie? 3, 2, 1. I'm going to bring her down quickly. and hold her head just like that for about 15 to 20 seconds. Do you feel dizzy?
No.
Good. So after 20 seconds, I'll bring her right back up. You would press start on the computer, it would start collecting that data. I'll just show you the left side real quick. Bring it to the left, same thing, 3, 2, 1, bring her all the way down. Quick movement, hold it 20 seconds, bring her back up. All right, that takes a little practice. We're gonna do a quick demonstration of the VEM test. So VEM, what does VEM stand for? I know what VEM stands for. VEM stands for vestibular evoked myogenic potential. We have CVEMs and OVEMs. With CVEMs, we're gonna put the electrodes on their neck. C stands for cervical. And then we're gonna do OVEMs. O stands for ocular. We're gonna put the electrodes right under the veteran's eyes. All right, so here we want CVEM, and we're gonna start setting up the veteran. You're gonna have your veteran laying, you want the bench at 30 degrees. All right, you're gonna measure to make sure it's exactly at 30 degrees with, what's this called?
Scale?
With the scale, you're gonna make sure it's at 30 degrees.
Level.
With the level? With the level? Whatever it's called. All right, you're gonna have your veteran lean back. So the way we clean for VEMs, I'm not gonna actually clean Leslie, but I'll show you. We use alcohol pads and we use this new prep. We want the veteran's skin to be extremely clean because we want the best. We want the lowest impedance. So that's why we clean. As you see here, for CVEMs, we're gonna clean on the veteran's forehead, where we'll put one electrode. Called the ground. And then we're gonna put, we want the vertex. What's it called, vertex? We want the vertex right here. We're gonna lower the veteran's shirt and just clean right here. You could also put the vertex on the chin if they're like a very hairy veteran. You could put on their chin, okay? And then we're gonna clean 2 spots on the neck. So we wanna put the electrodes on their sternocleidomastoid SCM. All right. So we're gonna put it on the SCM muscle. I do not want to pronounce that. So SCM muscle. So we're gonna have the veteran turn their head. As you see, when she turns her head and lifts her neck, you could see that muscle popping out. So we would clean right here. We want it on the belly of the muscle, right here. Go ahead and look my way. Same thing, the muscle right here, we'd clean right here. Okay, clean with the alcohol and the new prep. Go ahead and lean back. For the OVEMs, only clean with alcohol. You don't want to rub new prep under their eyes. And I would clean right under the veteran's eyes. Okay. First, clean for CVEM, do the CVEM test. Then clean for OVEM, do the OVEM test. Let me show you the equipment. No, they'll stand there. So for the VEMs, we have headphones. So with the VEMs, what you're going to do is play a really loud sound in one of the ears. All right. So if I had it going in Leslie's right ear, she's going to lift her neck up and look towards the left. All right. If I had the sound in her right ear, she's going to lift her neck up and go to the right. Basically, we want that neck muscle contraction going when the sound is clicking. All right, on the screen in front of you, you're going to see the lights going to green, meaning that we have some good muscle contraction and it's collecting some good data. So headphones in and electrodes on. All right, these electrodes are the ones we're going to put where we cleaned her. So red is right. I suck. So red is right. The yellow is for the vertex. The beige color is for the vertex, which we put right here. The black is for the ground, which we put on your forehead. And the blue is left, so we put on the left sternocleidomastoid. With all that equipment set up, here's the little vent machine where we plug everything in back here. We would start the test, okay? So veteran is clean, veteran has electrodes, veteran has headphones in. All right, we could come over to the computer where I'll show you how we start the test. So first thing you want to I have it on that paper I sent. So 75 dB, if your veteran has some sort of disorder, that 75 dB might be extremely loud for them and it might cause them pain. So if you go any higher, it'll be very excruciating for them. So that hence we want to start with 75 dB. If they're okay, you're going to go higher and you're going to look for a vent response. So at 100 dB, you should see a nice clear vent. for our veterans if they're nice and healthy and everything's going okay. So we would start with the left ear, we then go to the right ear. Keep in mind that if I press start, Leslie's going to contract her neck muscle. Go ahead and contract your neck muscle. And she's going to be sitting like that. That could get very annoying for a veteran. So only do 2 to 3 levels at a time, then give them a rest. Go ahead and rest, Leslie. Do another 2, 3 levels until you get that vamp. With a vamp, you also want to find a threshold. If you have a nice vamp at 100 dB, make sure you go down until that vamp disappears, and then then you'll find the right threshold. So for the C vamps, your veteran is going to contract their neck muscle and look straight. For O vamps, you're going to have your veteran look up. That's how you're going to contract that muscle. So we like to tell the veteran to look up at the projector, just like that. So now we're contracting that muscle. We're getting the O vamp response.